So, portal hypertension. What is portal hypertension? From the name, you would see that we're talking about the portal vein or the portal venous system. And then hypertension is an increase in the blood pressure. So portal hypertension is simply an increase in the blood pressure within the portal venous system. Now, here, let me see if I can go to the full screen. Okay, so portal venous system, we said, or portal hypertension, we said, is caused by liver cirrhosis. The major cause of portal hypertension is the cirrhosis of the liver. But we also said that we could have what we call extra hepatic cause of portal hypertension. And that extra hepatic cause could be thrombosis of the portal vein, while the intrahepatic cause is cirrhosis of the liver, which is the primary or the most common cause of portal hypertension. So in cases like cirrhosis of the liver, the anastomosis between the portal system and the caval system, which we call the portocaval anastomosis, becomes congested. Why is it congested? Because in liver cirrhosis, blood cannot pass from the portal vein into the liver. And when blood cannot enter the liver, the blood cannot leave the liver through the hepatic vein. So what happens is that there is congestion of blood in the portal vein, and the anastomosis between the portal vein and the caval or the inferior vena cava becomes congested with blood, and that will lead to venous dilatation. So in liver cirrhosis, we have high blood pressure in the venous system, in the portal venous system, and that high blood pressure is because of congestion of blood in the portal vein and the associated portal vessels. Now, that increased volume in the blood vessels will lead to dilatation. So the veins will become dilated because of too much blood in them. And this blood is at high pressure. And as a result, the places where there is anastomosis between the caval and the portal system, we have such dilatations, and that will lead to what we call esophageal varices in the esophageal region, where we have an anastomosis between the esophageal branch of the left gastric artery and the esophageal branch of the vein, left gastric vein, and the esophageal branch of the azygos vein. So that will cause esophageal varices. And then we'll also have such dilatations in the rectum or in the anus, the anal region, and that will lead to rectal hemorrhoids. And we said in the rectum, we have the anastomosis between the superior rectal vein and the middle and inferior rectal veins. And then we also have what we call the caput medusa, which is due to anastomosis dilatation in the anastomosis between the paraumbilical vein and the superficial epigastric veins in the anterior abdominal wall. Now, portal hypertension causes problems which we summarize as gut, butt, and caput. So anywhere you see gut, butt, and caput, remember that we are talking about portal hypertension. What does it mean? So gut means the esophageal varices. This one, esophageal varices in the guts. Okay. Butt means hemorrhoids in the anal canal or the anus. Rectal hemorrhoid means butt, while caput means caput medusa. So if you see in any exam that says which of the following condition is represented by gut, butt, and caput. So it simply means portal hypertension. Portal hypertension, that's what it means. Okay. Now, so portal hypertension, guts. Let's start with guts. So what happens in guts? So guts simply means that there is, so at the gut level or at the esophageal level, we have anastomosis between esophageal branches of left gastric vein, which represents the portal system, while we have esophageal branches of azygos vein, which represent the systemic system or the caval system. So we have portocaval anastomosis. So at the gut level, the anastomosis is between esophageal branches of left gastric vein and the esophageal branches of azygos vein. So what happens when there is dilatation of this anastomosis because of portal hypertension or because of liver cirrhosis or blockade of the portal vein? I forgot to mention yesterday that there is also what we call post-hepatic or suprahepatic cause of portal hypertension. And that has to do with obstruction of the or thrombosis of the hepatic vein. I mentioned thrombosis of the portal vein. I mentioned liver cirrhosis. And also there is what we call suprahepatic thrombosis. So what happens is that there is the hepatic vein that's supposed to drain the liver is blocked, and there is thrombosis of that hepatic vein. And we call that syndrome Budd-Chiari syndrome. Budd-Chiari syndrome. So you need to write that somewhere. Budd-Chiari syndrome. B-U-D-D, B-U-D-D, then Chiari. Budd-Chiari, B-U-D-D, C-H-I-A-R-O-I, Budd-Chiari syndrome. So in Budd-Chiari syndrome, there is a blood clot blocking the hepatic vein. So the hepatic vein cannot drain blood from the liver. And if blood cannot be drained from the liver, it means that the liver cannot receive more blood from the portal vein. And when that happens, we'll have portal hypertension also. So it could be a reason of portal hypertension. So blood will gather in the liver because the blood cannot leave. The hepatic vein cannot drain the liver. So blood gathers in the liver, and that leads to hepatomegaly. So the liver becomes bigger than usual, full of blood that was supposed to be carried out through the hepatic vein. And this is venous blood that's supposed to be drained. So that venous blood will gather in the liver, and that will lead to other, problems, and that will affect the liver function also, and lead to hypertension, lead to portal hypertension. Okay. Now, so it means that Budd-Chiari syndrome will be a post-hepatic cause or post-sinusoidal cause of portal hypertension. So three main causes of portal hypertension. One is intrahepatic, which is liver cirrhosis. So the liver is destroyed, liver cells and liver structure is destroyed. So that's liver cirrhosis. Either you say it is intrahepatic cause, or you say it is sinusoidal cause. Some exams, some questions will ask you, they will not say intrahepatic, they will say sinusoidal cause of portal hypertension. So that would be liver cirrhosis. Then pre-sinusoidal cause of liver portal hypertension will be portal venous thrombosis. So thrombosis of the portal vein. That is before you get to the liver. So pre-sinusoidal or pre-hepatic cause of portal hypertension. So blockage of the portal vein. Then post-sinusoidal, or what you could say post-hepatic or suprahepatic, is after the liver. So hepatic vein thrombosis, which is Budd-Chiari syndrome. Okay, but now this slide is talking about anastomosis between esophageal branches of left gastric vein and esophageal branches of azygos vein around the esophagus or the lower third of the esophagus. So what will happen if there is dilatation? We'll have esophageal varices. Then here, the second one is 1 minute. Okay, good. So the second one, okay. The second one is the anastomosis between the superior rectal. Oh, okay, yeah. See what I was saying? So that anastomosis, that initial anastomosis between esophageal branches of azygos vein and esophageal branches of left gastric vein occurs in the esophageal region, and the clinical condition that will result in the portal hypertension is esophageal varices. Okay, now the next region we need to look at is, 1 minute. Okay, I think I need to do this. The next region we need to look at.
Portal esophageal branches of left gastric V. Systemic esophageal branches of azygos V.
Okay. I'm trying to move to the next slide, but it's showing me the same thing. Okay. Give me 1 minute. Okay. Yeah. Okay. Okay, so the next region is the anal region, yeah? The anal region or the rectum. We have anastomosis between the superior rectal vein of the portal system and the middle rectal vein and inferior rectal vein of the caval or systemic system. So this anastomosis is happening in the anal or rectum area, in the anal or rectum area. Okay, so what will happen if there is portal hypertension in the rectal area? We'll have rectal varices. Rectal varices. The rectal varices is dilatation of the superior rectal vein and the inferior and middle rectal vein as a result of portal hypertension. Okay. So the next region is the umbilical region. The umbilical region. So the umbilical region, we have anastomosis between the paraumbilical vein of the portal system and the superficial epigastric vein of the caval system, portocaval anastomosis. And where is the region? Where is this happening? This is happening in the paraumbilical region. And what is the clinical condition that you will see if there is portal hypertension? You will see caput medusa. You will see caput medusa. Okay. Then there is one more region, but we said that region does not really produce any serious clinical condition. So the region is a retroperitoneal region. And what happens if there is portal hypertension? There is no clinical name to what happens if there is portal hypertension. But we have 1 minute. Okay. So we have anastomosis between the right, left, and middle colic veins from the portal system, anastomosis with the renal, suprarenal, and the gonadal veins. So this is the portocaval anastomosis that takes place in the retroperitoneal area, but there is no name for the clinical manifestation of clinical significance if there is portal hypertension. So the first three are the most important ones: the esophageal region, the paraumbilical region, and the rectal region. These ones have symptoms, clinical symptoms that you see in portal hypertension, but the retroperitoneal region does not really have any clinical symptom if there is portal hypertension. Then the last region, we have the intrahepatic region, and the clinical condition that happens is that there is patent ductus venosus, patent ductus venosus, and that the anastomosis that happens there, we say that there is anastomosis between the left branch of the portal vein and the inferior vena cava, the left branch of the portal vein and the inferior vena cava. And then what is the treatment of portal hypertension? So the treatment is surgical treatment, and it involves side-to-side anastomosis between the hepatic portal vein and the inferior vena cava, then end-to-side anastomosis between the hepatic portal vein and the inferior vena cava, and then you have central splenorenal anastomosis between the splenic vein and the left renal vein. So the reason for this anastomosis is to release the pressure and allow blood to flow from the portal system, which is already filled with blood. And the vessels are dilated already because of congestion of blood. So what you do, you create anastomosis between the hepatic portal vein and the inferior vena cava. So once blood flows from this portal vein to the inferior vena cava, all the other blood vessels that were dilated and congested with blood will no longer be congested, and so would have reduced the tension and the volume of blood in those anastomosis. Yeah, so that is how you treat portal hypertension. Okay, so now let's do a quick revision. From this diagram, again, a summary of portocaval anastomosis and the clinical significance. So the first point of anastomosis is here between the esophageal branches of the left gastric vein, which is part of the portal system, and the esophageal veins to the azygos vein, which is part of the systemic or caval system. So we have portocaval anastomosis here. The second point is at the umbilicus. So at the umbilicus, we have the paraumbilical vein, which is part of the portal system, and the superficial epigastric veins, which are part of the caval or the systemic system. And these superficial epigastric veins are coming from the external iliac vein, while the paraumbilical vein is coming from the left branch of the portal vein. within the liver, so that the paraumbilical vein. So here we have this anastomosis at the umbilicus. And when the pressure here increases under portal hypertension, we will have caput medusa. When the pressure here increases under in portal hypertension, the veins here will become dilated and will have esophageal varices. The third point is in the anal region, where we have anastomosis between the superior rectal vein of the portal system and the middle and inferior rectal veins of the systemic or caval system. So that's anastomosis here. When blood pressure increases due to congestion and increased blood volume, we'll have hemorrhoids. We'll have hemorrhoids here. And then the fourth anastomosis is between the colic veins, and the renal veins or retroperitoneal veins of the retroperitoneal or posterior abdominal wall. Okay, so here there is no name for the clinical symptom that happens, clinical effect when there is portal hypertension. And then the last one we said is the anastomosis between the portal vein and the inferior vena cava. And this leads to patent ductus venosus. So here, let's see, the clinical significance we said are guts, butt, and caput medusa. So esophageal varices, veins in the lower esophageal region become distended and tortuous, which may rupture, causing hematemesis, which is vomiting of blood. So that is a sign that the patient has esophageal varices, hematemesis. And then we have caput medusa, which occurs in the paraumbilical region where there's dilated and tortuous veins of the paraumbilical region. And that the dilated veins resemble the head of a Greek mythological creature called Medusa. So in Greek mythology, they have somebody they called his name is Medusa, and he's like a protector, like a spiritual protector to the Greek people, and his head was like his hair was like snakes. So on top of his head, he has something that looks like snake, like more like dreadlocks. Yeah, dreadlocks, but they look like snakes. So that is why they call the vein dilatation of the abdominal veins caput medusa, because when the veins dilate, they resemble the head of Medusa. Okay. Then hemorrhoids. At the rectal region, we have the distended and dilated vessels. And which vessels are we talking about? We're talking about the superior rectal vein, the middle rectal vein, and the inferior rectal vein. They become dilated, and that might lead to bleeding in the anus, and that's what we call hemorrhoids. Then another thing that you could see, we said splenomegaly, yeah, because the splenic vein is a major part of the portal vein. So if there's portal hypertension, the splenic vein, there'll be backflow of blood into the splenic vein, which would lead to, so here you see the splenic vein. So if there's portal hypertension, there's backflow of blood into the spleen, which could lead to an enlarged spleen. Sometimes in a patient with portal hypertension, if that portal hypertension is due to Budd-Chiari syndrome, which is thrombosis of the hepatic vein, it means that the hepatic vein cannot drain blood from the liver. So blood will gather in the liver, and there will also be hepatomegaly. All right, there'll be hepatomegaly. And one thing you need to know is that most times a patient with liver cirrhosis will have some what we call hepatic encephalopathy. where you have excess ammonia in the brain. Why? Because the liver is supposed to excrete that ammonia or detoxify the blood, remove ammonia from the blood. But now that the liver cirrhosis, the liver can no longer perform that function. And what happens is that excess ammonia is carried to the brain, and causes damage to the brain. And so it will have some neurological symptoms, which are caused not because there is a problem with the brain, but because excess ammonia from the liver has been transported to the brain to cause some defects or some metabolic changes in the brain structure. And that could lead to some symptoms in the brain. So that happens. That could also be a sign. If a patient has liver cirrhosis or has portal hypertension, you should expect to see some neurological changes. And those neurological changes are caused by excess ammonia or excess protein breakdown product of protein. And we call that hepatic encephalopathy. But I'll teach more on that one in physiology class when we discuss this topic under physiology. I'll talk more about liver cirrhosis and hepatic encephalopathy. Okay, good. So I think that will be everything you need to know about portocaval anastomosis and portal hypertension. I decided to do this revision because of how important this topic is. So I will expect that you remember everything that we have talked about, know the names of the veins that make up the anastomosis at the three regions, the esophageal region especially, the paraumbilical region, and the rectal region. These three regions you must remember. The other two regions are not as important as the first three regions. And you must know the names of the arteries, which one of the veins, which ones are part of the portal system, and which ones are part of the caval or systemic system. You should remember all of them for exam purposes and also for clinical practice as a doctor where you have. Okay. So I think that will be all for today. In the next class, we would answer as many questions as possible from this topic. I'll get some MCQ questions on portal hypertension and portocaval anastomosis. And then we can also answer questions on different types of anemia. We didn't finish those questions we were answering the last time. So we'll answer two sets of questions in the next class. We'll answer questions about this topic and questions about all the different types of anemia. Okay.